You do two placements, and for both of them it's a very similar process. You put in what's similar to a job application. You're telling them what your experience is, what your interests are. So you're not only telling experiences, you're also trying to show what your learning needs are. It's a difficult thing, placement, because it's not possible to get everyone the perfect placement. And my advice is to keep a fairly broad mind in both years, but especially in the first year. Allow yourself to go somewhere that, maybe it wasn't your first choice, but you will learn. And the second one is important to get near your choice. If not, I was lucky, I got exactly what I wanted in older people. But I think it is important to get that one right. And most people get what they want for second place. So I got my first placement with Age UK, which is obviously older people, voluntary sector, very hands-on, very full, learnt absolutely loads, and I did really enjoy it. It's hard work, but it was good. And then I wanted to have the statutory version, if you like, and have managed to get to an older people team with disabilities as well. So for me, it was a very good combination. So now I'm finding out the difference between the statutory and the voluntary sector, and I would say it's very useful to have one voluntary and one statutory placement. I think it's a really good, broad experience. And in the statutory placement, I'm working under the Mental Capacity Act, obviously the National Health Service Community Care Act, also looking at safeguarding as well. I've had a little bit of experience with safeguarding. So, and yes, just the routine assessments, which are never routine, they're always really interesting, and meeting a lot of interesting people. And yeah, it's been good, but it is very different to voluntary sector. You have very defined roles, and they'd like you to keep moving on rather than keep working very intensely with one or two people. Interesting question. The teaching definitely gives you the kind of foundation, but sometimes you're sitting in lectures thinking, I don't really understand how you do a mental capacity assessment, I don't really understand how a safeguarding process works. So it's always a little bit theoretical, but you need it, because when you're on placement you suddenly find you might be talking to someone with dementia, you realise they may not have capacity, you're wondering how you're going to help make a decision with them, and you draw on that learning very quickly. Some of the learning was outside of the experience you have on placement. It's bound to be, because you're covering a broad subject with the learning. But it's nice to know it's there. I'm aware of the Mental Health Act and the Children's Act, and although I'm not using them very directly in my work, I need to know about them.